Hi, this is Tyler Foster, and welcome to the Pharmacology section on autonomic drugs. Before we start our discussion on the nervous system, I find it useful to create a flowchart which can act as sort of our table of contents. Then once we create this nice big picture, we'll then zoom in on the different components and discuss those in more detail. So let's go ahead and begin. We start off with the general category of the nervous system. This can be broken down into both the central nervous system and the peripheral nervous system. So what makes up the central nervous system? The central nervous system comprises of the brain and the spinal cord, while the peripheral nervous system is going to include everything else. The peripheral nervous system is comprised of both motor units and sensory units. Sensory units bring information into it'll meet nicotinic receptors and then continue the action potential downwards. So the action potential will make its way down this postsynaptic neuron, and here we'll slow down our discussion because not all postsynaptic neurons are going to be the same. All presynaptic neurons are going to release acetylcholine onto nicotinic receptors, and then we're going to start slowing down our discussion because this is where the water gets a little murky. So do you remember what the two-neuron circuit of the autonomic nervous system was called? Yeah, it was the disynaptic system. Now the parasympathetic system is part of the autonomic nervous system, and therefore it's going to use that disynaptic system like we just discussed. So let's go ahead and talk about the parasympathetic nervous system. Now here we have our central nervous system, which is going to include our brain and spinal cord, and we have some end target organs. The presynaptic neuron, remember that's the first neuron, is going to be the same. It's going to release our neurotransmitter acetylcholine on the postsynaptic neuron, and that's going to be affected at nicotinic receptors. So nothing has changed. Now what's different with the parasympathetic system is our postsynaptic neuron is going to connect now to our end target organs. We have our cardiac tissue, gland cells, smooth muscle, and nerve terminals. So here is where it gets a little bit different. The postsynaptic neurons are going to release acetylcholine, just like we saw before. So this is no different than before. However, the parasympathetic nervous system will usually exert its effect upon muscarinic receptors. So instead of nicotinic receptors like we saw here between the presynaptic and postsynaptic neurons, our end target organs will be affected at the muscarinic receptor. So later on in the lecture, I'm going to go into the details about the different receptor types like the nicotinic, muscarinic, etc. But for now, I just want you to remember that the parasympathetic nervous system is going to activate muscarinic receptors at the end organ. The other component of the autonomic nervous system was our sympathetic nervous system. The sympathetic system is slightly more complicated now. The sympathetic system is going to use our two-neuron system just like the parasympathetic system did. However, this time, the presynaptic neuron is going to travel to a ganglion within our sympathetic trunk. So let's go ahead and draw that in. We have our presynaptic neuron. It's going to find its way to a ganglion within the sympathetic trunk. Do you know another name for this presynaptic neuron? Well, we can also call it the preganglionic neuron since it has not yet entered the ganglion. So our presynaptic preganglionic neuron will enter the ganglion, which is just a grouping of nerve cell bodies. That's all a ganglion is. So here it's going to synapse with a postsynaptic neuron, which can also be termed a postganglionic neuron. Can you guess what neurotransmitter the preganglionic neuron is going to release upon the postganglionic neuron at the synapse? Well, hopefully you're thinking acetylcholine. And can you guess what type of receptor is on this postganglionic neuron? Yeah, it's a nicotinic receptor, just like we saw before. So now let's go ahead and follow this postganglionic neuron. It's going to travel to a target end organ and release a neurotransmitter. Now that neurotransmitter is going to vary depending on what that end organ is. So here we go, we drew on our postganglionic neuron. It found its end target organ. It could either be a cardiac muscle cell, a smooth muscle, gland cell, or a nerve terminal. Now, do you have any idea of what neurotransmitter is going to be released here at this synapse? Well, let's think it through. The sympathetic nervous system is going to be our fight or flight system. So the neurotransmitter that gets released is going to be norepinephrine. Now, norepinephrine is going to act upon alpha and beta receptors to exert some sort of effect. Now, don't worry about the specifics yet. We're going to be covering that in a few slides when we talk about these specific receptors. But for now, I just want you to know that the sympathetic system usually works via norepinephrine at the alpha and the beta receptors on these end target organs. Now, I'm going to backtrack just a little bit. I said that the sympathetic system usually acts via norepinephrine. We have three exceptions to the normal sympathetic innervation that you see here. The USMLE loves to test these exceptions So make sure that you remember these. So I'm actually going to star this slide because the USMLE loves exceptions, so I think it would be very good to know these. So we're going to start off. Sweat glands. Sweat glands are the first exception to this normal system rule. The postganglionic neurons of the sympathetic nervous system will usually release acetylcholine instead of norepinephrine. So here we have a postganglionic neuron, and it's going to release acetylcholine instead of norepinephrine. And actually, the acetylcholine will act upon muscarinic receptors, causing the sweat release from these sweat glands. So here's an easy way that I like to think of it. Let's pretend that this is the day of the USMLE test. You're going to arrive at the test facility and you start to become nervous. Well, actually you personally won't become nervous since you've prepared well with these videos, but let's just pretend that you know somebody that's nervous. As you watch them sit there in the lobby of the test center waiting to be seated for the exam, their hands get a little clammy and sweaty. Well, what system is working? Is it going to be their parasympathetic system or their sympathetic nervous system? Well, of course, it's going to be the sympathetic nervous system, or that fight or flight system, that's going to be activated, which is going to be causing their hands to get nice and sweaty. If they were to sit there and sniff their wet, sweaty hands, their sweaty hands may smell a little musky. Remember that musky hands are sympathetically innervated and act via the muscarinic receptor. Musky hands, musky receptor. Just remember it like that. All right. The adrenal medulla is also an exception to our sympathetic normal innervation. The adrenal medulla is not going to use our disynaptic system because our presynaptic neuron is going to terminate directly on the end organ. We don't have two neurons, we're just going to have one neuron here. So we completely bypass the postganglionic neuron in this case. The preganglionic neuron will release acetylcholine on our adrenal medulla, which is going to activate it. So let's think back to embryology. Do you remember what type of tissue the adrenal medulla is derived from? Well, the adrenal medulla is derived from neural crest tissue, and it can be thought of as being a ganglion itself, which releases catecholamines postsynaptically into the bloodstream. So our acetylcholine will act upon a nicotinic receptor on the adrenal gland, and that adrenal gland therefore goes on to release epinephrine and norepinephrine into the bloodstream. All right, so this is exception number 1. This is exception number 2. I promised that there were going to be 3 exceptions. So our third exception to the to our sympathetic normal route, which is the top route here that I'm kind of circling, will involve our renal vasculature smooth muscle. So the postganglionic neurons will release dopamine upon, so let's go ahead and draw this in. We still have the exact same system. However, this time our postganglionic neuron is going to release dopamine on our receptor, and actually it'll be on D1 receptors of the smooth muscle. So the D1 receptors of the renal vasculature smooth muscle will cause it to relax, which will increase renal perfusion, and more specifically the D1 receptors are found along the afferent arteriole. So what is the difference between the afferent and the efferent arteriole? The afferent arteriole will lead towards the glomerulus, where the efferent, which starts with an E, will lead away from the glomerulus. So if you relax the afferent artery, you will allow more blood to enter the glomerulus, so actually there will be more perfusion to the kidney. If a patient is in shock and you're worried about renal perfusion, well, you'll likely want to give a drug that'll activate D1 receptors to increase blood flow to the kidney. So just remember that these are 3 exceptions. So 1, 2, and number 3 exceptions to the sympathetic system, which here is the normal route. And you'll likely see these on test day because the USMLE loves to test exceptions. It is also important to note that the sympathetic and parasympathetic systems do not act in isolation. Most end organs are actually duly innervated by both the sympathetic and the parasympathetic side. The end effects just depend on what the system is activated to a higher degree, which one's working harder. So it's similar to a teeter-totter here. We have on one side the sympathetic side and on one side the parasympathetic side. Each system will be weighted higher depending on the scenario. So after a meal, the parasympathetic side is going to outweigh the sympathetic side. So parasympathetic side will be activated higher. Now if you're walking through a haunted house, you would expect that the sympathetic side would be weighted higher and more active. As promised before, we're going to now talk about receptors. But before we start covering the different receptor types, I'm just going to give you a receptor flowchart to kind of help organize the following material. This should act as a sort of table of contents for what our story over receptors will be. So we start off with the general category of receptors. Now, our receptors can be broken down into two different categories. They can either be cholinergic or adrenergic. So cholinergic receptors usually use the neurotransmitter acetylcholine as its transmitter, while our adrenergic receptors rely on catecholamines as the neurotransmitter. So back to our cholinergic receptors, we can further break down the cholinergic receptors into either nicotinic receptors or muscarinic receptors, while our adrenergic receptors can be broken down into either alpha or beta. So these alpha and beta receptors can be further broken down, I know this is where it gets murky, into either alpha 1 or alpha 2, and our betas can be broken down into beta 1 and beta 2. So this chart is a very simplified version of what's going on, but hopefully it'll give you a good idea of how things are organized. Now there are also some other subcategories that I'll discuss later on in the lecture. This is an excellent time to test comprehension. Which two components of the sympathetic nervous system are innervated by cholinergic fibers? Remember that the sympathetic nervous system is the fight or flight system and mostly uses catecholamines such as norepinephrine, our sympathetic system. However, there are exceptions to this rule which are often tested on the USMLE. So our two components that are going to be innervated by the cholinergic fibers are going to be our adrenal medulla and sweat glands. These are both sympathetically activated but innervated by cholinergic fibers that use acetylcholine as the neurotransmitter. The adrenal medulla is innervated by preganglionic or presynaptic neurons that release acetylcholine, and our sweat glands are innervated by the sympathetic nervous system, but these use acetylcholine upon muscarinic receptors from that second neuron, our postsynaptic neuron. So remember these caveats, go back to the earlier slide if you need a quick refresher, because these may end up giving you easy points on test day.